The time nutrition in mountain agro-ecosystem project phase 1 has begun. The problem and the extent of malnutrition in Ethiopia was alarming at national level. Thanks to IFAM, this project came up with food approach intervention and empowering of rural service providers in the country. 25 rural service providers with a proportional number of females received intensive capacity building trainings and implemented 25 micro-interventions. Each trained rural service provider through micro-intervention in turn trained 40 mothers and did behavior change intervention to promote diversified production and consumption of food to benefit for more than 5,000 mothers and children. The trained rural service providers have also linked with global partners using the Mountain Agriculture Action Network platform and remained as linked social capital for further networking and continuation of the project in phase 2. Further, the evaluation of human dietary diversity showed a progress from 4 to 5.5 following micro-interventions in the project areas. These results provided opportunity to synthesize the need for nutrition-sensitive agriculture in national nutrition discussion forums and broadened mindset of policymakers to think beyond immediate quick fixes. Using the experiences and lessons of the project phase 1, the project phase 2 has strategic interventions continued with institutionalizing nutrition-sensitive agriculture intervention. This systematic approach is for scaling up nutrition-sensitive intervention and capacity development program in order to also obtain policy and strategic support in Ethiopia. Totally, 7 scaling up nutrition-sensitive intervention projects have been under implementation, each targeting 500 producers and 5,000 consumers, with 50% of the project fund mobilized from rural service providers, local institutions. These projects have primarily focused on promotion of diversified production and consumption of healthy and nutritious foods, mainly for women and children. The intervention includes community-level advocacy, such as food fair and peer learning, to further scaling out other communities. The best experiences of these interventions were documented, appropriate messages formulated, and shared with high-level decision makers on the National Advocacy Workshop, which IST co-hosted with the Ministry of Agriculture 2 times in phase 2. The scaling up nutrition-sensitive intervention approach has brought evidence-based advocacy at national level and strengthened partnership with the government and other actors. The implementation of training of team of trainers under phase 2 enabled to have 3 teams of trainers for training of the consecutive generations of rural service providers. These Ethiopian teams have trained a total of 75 new rural service providers who have further developed specific micro-interventions to promote nutrition-sensitive agriculture in Ethiopia. Similarly, one training of team of trainers from Kenya trained in Ethiopia has trained 25 rural service providers who have developed micro-interventions and are working with communities in Kenya. Both scaling up nutrition-sensitive interventions and micro-interventions under capacity development program, as seen from the video, have positively impacted households to exercise growing diversified agriculture production at homestead areas of individual households, condominium sites and university campus, open spaces, applying kitchen gardening techniques. The food fairs at community and regional level enabled to promote the value of local foods, and open public forum discussion among different stakeholders in nutrition works. This is from Ethiopia, the land of origins, and with IFAM support.